Hi, all you future nursing students out there. This is Dr. Susan, here to introduce one of the greatest groups in the universe, the painkillers. And today, we're going to talk to you all about SBAR. Check it out.
Well, hello there, all. My name is Nurse Rebecca Quanda. I'm here at my favorite place in the whole entire world, the hospital, taking care of patients and saving lives. Today, we're not going to be talking about me, although we could do that all day if you want to. Today, we're going to be checking in with my student Zoe to see how she's doing. Zoe, where you at, honey buns?
Nurse Becky, please help!
What's wrong, baby girl?
Becky, I am worried about my patient Ellen.
Oh no, what happened to her?
Well, Jackie, you see, my patient Ellen is a 75-year-old female with chronic renal failure.
Okay.
My patient has a history of hypertension, coronary artery disease, and she's also a diabetic. Ellen went to visit her doctor a couple of days ago because she felt short of breath. The doctor advised that she come to the hospital.
And she's here now?
Yes, Becky. She also tells me that she doesn't use the bathroom as often as she used to. Her ankles and her calves are swollen, Becky.
Oh my God!
Yes, I completed my assessment and I found that she also has crackles in her lower lobes.
Well, dear God.
I am worried about her, Jackie. Will you please help me?
Well, baby girl, what would you like to do?
Well, I don't know, Jackie. Can you tell me what I should do?
Well, what you need to do, besides bake me a pie, is you need to call the doctor.
Call the doctor?
The doctor!
Jackie,
What?
Becky, I've never had to call the doctor before. I'm a little worried. I've never had to interact with a doctor. I'm scared.
It's okay, honey buns. I'll help you. What we gotta do is we got to utilize the SBAR.
SBAR?
SBAR!
Becky, I don't know what that is.
Well, SBAR is...
What is SBAR? S stands for situation.
Hey guys, Dr. Susan here to talk about the situation portion of the SBAR. So, for SBAR, you'll want to call the physician and identify the patient and where they're located. So, in this situation, we want to say that the situation is a patient who is 75 years old. She's admitting with a diagnosis of chronic renal failure. She complains of shortness of breath, decreased urine output, and less bathroom usage that has worsened within the last 2 months.
That was the situation. B stands for background.
The nurse provides background information. This includes information relevant to the current situation, mental status, current vital signs. The nurse talks about the chief complaint, pain level, and the physical assessment of the patient. The current background, the patient has a history of cardiac disease, hypertension, and diabetes. That is the background.
B stands for background. A stands for assessment.
The nurse offers an assessment of the chief problem and describes the seriousness of the situation. Any specific changes in the patient's condition should be described, such as vital signs. The patient's vital signs are 98.6, the blood pressure is 160/82, the heart rate is 78. Respirations are 28, and O2 saturation is 92% on room air. The patient has 3+ bilateral pitting in the ankle and the calves, crackles in the bilateral lobes, and palpable fetal post-tibial pulses.
That's what the assessment is. A for assessment. R stands for request/recommendation.
The nurse can make a request of the physician or suggest specific action such as a medication, lab work, or an x-ray exam. The nurse could also request that the physician come and evaluate the patient. In this scenario, a recommendation may look like asking for a peripheral IV, a nasal cannula set at 2 liters, and labs such as GFR, creatinine, and BUN. The nurse can also ask for medications such as a diuretic.
R stands for recommendation. That was SBAR.
So now that we know what SBAR is, let's see it in action when Zoe calls the doctor. Bring, 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 bring.
Hello, Dr. Susan here. How may I help you?
Hi, Dr. Susan. This is Zoe. I'm a nursing student, and I'm working with Nurse Becky today.
Oh, hey Zoe, I know you. How's it going?
I'm doing okay, doctor, but I'd like to chat with you about one of my patients.
Okay, go right on ahead.
Okay, well, my patient's name is Ellen. She's 75 years old. She's admitted with a diagnosis of chronic renal failure. She's complaining of shortness of breath, decreased urine output, and she hasn't used the bathroom as often in the last 2 months.
Wow, that's really bad.
My patient's history, doctor, is coronary artery disease. She's hypertensive, and she's also a diabetic.
Oh my gosh, that poor thing.
Upon assessment, doctor, I have found that my patient's temperature is 98.6. She has a blood pressure of 160/82. Heart rate is 78. 28 respirations and 92% oxygen saturation on room air. My patient also has 3+ bilateral pitting ankle and calf edema, crackles in the bilateral lower lobes, and she has palpable pedal and post-tibial pulses.
She sounds really messed up. What are we gonna do?
Well, doctor, I'd like to recommend that we insert a peripheral IV for my patient and her medication administration. I'd also like to suggest that we place my patient on 2 liters of oxygen on a nasal cannula. I'd also like to do a blood draw for renal function labs such as GFR, creatinine, BUN, a chem panel, a CBC. My patient is also a diabetic, so I think that maybe an H1AC would also be good, a urine sample, and I would also suggest that Ellen be counseled on how she should take her current medications.
You know what? It sounds really good. I'm gonna go right on ahead and write those orders up for you. Hopefully she does a lot better.
Thank you for being so patient with me, doctor.
No problem.
Talk to you soon.
All right, sounds good. Bye-bye.
Zoe, how did calling the doctor go?
It went very well, Becky. Thanks for giving me confidence to do that.
Oh my gosh, you're so welcome. I'm so glad to hear you did so good.
Becky, the doctor said he'd put in some orders for me. Can you please help me verify that those are in?
Oh my gosh, of course I will, Sugar Plum.
Thank you so much. You are the best preceptor, Becky.
I know, I'm like an angel.
You are. Thank you very much for your help.
You're welcome.
That
Nurse Rebecca Quanda.
That includes our presentation of SBAR.
Nurse Rebecca Quanda, played by Arisha.
Nurse Zoe, played by Magandi.
Dr. Susan here, played by Sergio Ibarra Perez.
Background puppet, played by Veronica.
Kyle, played by Melissa. Nurse Brittany, played by Kayla. And behind that